about CSC and the AMR program. So Center for Science and Environment is a non-profit public interest and advocacy organization based out of New Delhi. And we have been working on the issue of AMR for over a decade and a half in India, in Asian countries, and in African countries. And it's a very opportune moment also because this week we all know is a World Antimicrobial Awareness Week. And this is one part of our work that we are doing to create awareness. And there are many other parts of our work, particularly focused around the social media campaign that we are doing. And some of my colleagues here would actually also share links with you about those. Very briefly, let me share with you who all we have with us today to discuss very important issue. So we have Dr. Xavier Yawatsky from Ghana. We have Dr. Movaku Nadahi from Nigeria. We have Dr. Muhammad Abu Sufyan from Bangladesh. We also have with us Dr. Emmanuel Tanoi from Kenya. So as you can see, we have a fairly good representation of our colleagues and friends from Asia as well as Africa, and a fair bit of balance from the animal sector side and the health sector side. So we are hoping to learn from them what they are doing, what their countries are planning to do, what they have done, particularly with reference to how the prevention aspects in the political declaration can be taken forward. But before that, very quickly, I would like to welcome everyone again. We are grateful for your support, people who join us from different parts of the world, different parts of our country, One Health experts, people from the government, people from civil society. We are grateful for your support and that you come here and listen to us and take our messages forward. But just to let you know why we think this webinar was important, why we actually conducted this webinar. So we all know about political declaration. It was important because it came after so many years. It was the second one, the first one being in 2016. But the most important factor for us was that this particular declaration laid a very good emphasis on prevention. Prevention was something that we at Center for Science and Environment were very, very clear about, that this is something that is going to be a very important element approach to address the AMR, particularly in low and middle income countries. We knew that we all had, countries of Global South had national action plans, but there was not much success in most parts of the world, in most of such countries. And one of the reasons was that it was largely about that it was the finances required, the fact that it was a big menu list, the fact that it was perhaps less than practical and implementable. It was too much perhaps to ask for, and therefore there was a need to prioritize. And prioritization, therefore, as part of our journey, we learned from our interaction from many of the colleagues that prevention perhaps is one fundamental line that we can take for us to be able to take this forward. Now, we know that prevention, so why prevention? Prevention in our part of the world is affordable, no doubt about it. It is logical, it is very commonsensical that yes, this will work. In human health, we have heard prevention is better than cure, but that's actually a very universal statement and that can be applied to almost all sectors. Prevention has high returns of investment. Every penny you spend on prevention leaves you much higher returns rather than spending on something which is on the final treatment. Prevention perhaps is something which is agreeable to almost all stakeholders, scientific community as well as policymakers. The political will perhaps can be garnered or gathered much more if you advocate on the lines of prevention. Prevention perhaps also is doable. It is manageable. We all know how this entire thing about integrated surveillance struggled, right? We focused too much on resource-intensive surveillance, but we didn't really realize that we can actually focus more on preventing the disease to occur at its first place. That's what we perhaps need to now go forward with. But most importantly, this declaration is important, not just because prevention is in human health sector, but prevention is now important in animal health sector. Prevention is now recognized well, the importance of it in the environmental sector also. So, and it's not just about IPC. Now it's also about biosecurity. It's also about vaccination. So and it's more importantly, it's about WASH. So with these things in mind, these opening thoughts, I will request my colleague Gauri to actually very briefly let us know uh, what particular and specifically political declaration refers to when it means to prevention. It means when it actually touches upon prevention. So once we hear from her, we will actually very quickly open up and learn from our distinguished experts and distinguished colleagues from African and Asian nations that how they see this forward. We are hoping a very open discussion. We are hoping a very, I would say, very constructive discussion where this is not really about this country is doing good, this country is not doing good. There's no comparison happening here, all in the constructive spirit. We just want to learn from each other what is being done and what can potentially be done. So, with that, I request my colleague Gauri.
Thank
Gauri,
you,
please
Amit.
go ahead.
Yeah, I'll be sharing my screen. Just a second. I hope this is visible.
Yes, Gauri, please go ahead.
So hello everyone, my name is Gauri Arora and I'll be giving this presentation on behalf of the entire AMR team here at CSE. And like Amit has just mentioned, this presentation would be about diving deep in the preventive aspects that are mentioned in the political declaration on AMR, which was released in the high-level meeting. So the very important part of this political declaration, first, a little bit of background about this political declaration is that, like Amit has mentioned, it was adopted by 193 member states of the United Nations at a meeting in New York on the 26th of September. This is not the first declaration that has come out on AMR. This is the second declaration that has come out after 8 years, the first one being released in 2016. And a very important part of this declaration is that this has been broken down into different areas, uh, 7 areas in total, and uh, and it talks about different sectors, not just human health, but agriculture and environment as well. So the 7 sectors that this declaration talks about and breaks it down into these 7 sectors is governance, financing, access, coordinated multi-sectoral response, within which it looks at the human, agriculture, and the environment aspect, covering the One Health spectrum. Then it talks about the research and development, training, innovation, and manufacturing, surveillance and monitoring, and follow-up. So it breaks out AMR targets, commitments, and the recognition of the UNGA into these 7 sectors. We'll start with the financing sector. We'll start with the overall mention of the preventive aspects that were there in this political declaration. It reaffirms that improving the IPC measures, vaccination and sanitation wash could, of course, prevent more than 750,000 deaths each year from LMICs alone. But an important point to note here is that if this declaration took into consideration the animal and the environment aspects, we would have been able to prevent much more deaths in AMR. Looking at specifically the financing aspect of it, we all know that not just in terms of prevention, but financing the national action plans for LMICs is very important. So, looking at the preventive aspects of this declaration in financing, it recognizes the need to maintain and, whenever necessary, increase the sustainable investments at the national, regional, and the global level for strengthening the national capacities for antimicrobial resistance prevention. Not only this, it mentions commitments in which it encourages the existing financing mechanisms to increase the prevention of IPC through vaccination, research, development of new antimicrobials, WASH, IPC, and specifically supporting the implementation of multi-sectoral national action plans on AMR. Now, moving at the access part of this declaration, we all know that it's easy for us to say that LMICs should prevent AMR, but a very important part that is in general missed out is the equitable access to proper antimicrobials is not available in the LMICs as of now. So this declaration very importantly recognizes this, that there is a need of equitable and timely access to effective antimicrobials and diagnostics as well as vaccines, not just for human but for animal health is a challenge for LMICs, and that needs to be appropriately recognized. Not only this, it commits to accelerate the efforts to achieve an overall universal health coverage as a mean to ensure the access to essential health services as well as strengthen veterinary services. This is very important that it takes into consideration the animal aspects as well in terms of access. Overall, in a coordinated multi-sectoral response, a very important part of this declaration, once again, like Amit mentioned, is that it not only recognizes the human health, but now it notes the importance of improving the appropriate, not just IPC, but prudent and a responsible use of antimicrobials across the One Health sectors of human, animal, and plant health through an integrated delivery of policies in order to prevent disease in AMR and increase the antimicrobial stewardship. Within the coordinated multi-sectoral response, again, it's very easy or it's to say that LMICs should prevent AMR and promote WASH and having safe and hygienic practices. But how many of LMICs actually have an access of safe and clean drinking water, proper hygienic facilities, better waste management, and electricity? So this declaration actually recognizes this problem as it mentions that 22% of the world's healthcare facilities lack basic services and at least half lack basic hygienic services. And so it recognizes that there is a need for proper provision of safe water, hygiene, waste, electricity, and these services are fundamental for preventing the emergence, re-emergence, and the spread of AMR. Not only this, it commits to ensure that the minimum requirement of national IPC programs in healthcare facilities are needed to be in place. And it sets a target as well for this that 100% of countries having basic sanitation wash IPC measures, as well as 90% of countries meeting WHO's minimum requirements at national level by 2030. And here, at the very important point, that it not only recognizes that there is a need to prioritize the proper use and prudent use of antibiotics in the animal sector, it actually gives out three commitments in the agriculture and the animal sector. It strives to meaningfully reduce by 2030 the quantity of antimicrobials used in the agri-food system by investing in animal and plant health to prevent and control infections. Then it ensures that by 2030, the animal vaccination strategies are defined with an implementation program. And lastly, to invest in animal health systems to effectively support an equitable access to essential veterinary services. So it's a very big win for the agriculture and the animal health sector to not just recognize this, that there is a need for uh, proper and prudent use in this sector, but it also puts out some of the commitments that should be there. In the environment sector, again, it's a very important thing that this declaration has done is that now it underscores that environmental factors are in fact contributing to the development, the spread, the re-emergence of AMR, and there is a need to prioritize and prevent and address the discharge of antimicrobials and their metabolites in the environment, understand the sources from which uh, AMR is coming into the environment. Not just this, once again, it lays down a few commitments for specifically this environment sector to strengthen the health systems through prevention strategies such as stewardship programs for air, plant, water, soil, vector improvement management. And not only this, it addresses and recognizes that there is now a need to promote knowledge generation in terms of the environment sector, the sources of the environment sector in order to catalyze and mitigate, prevent the proper action, and to address the key pollution sources and the prevent contamination of the environment with antimicrobials and their metabolites. Within the research and development training aspect of this declaration, it notes with proper concern that there is a need, that the preventive measures that are currently there are absolutely inadequate, of course, including the transmission and exposure pathways. And there is a need for proper research and development, and the pipeline for vaccines and the antimicrobials are insufficient currently. I would like to close with this aspect that Amit has mentioned, that in our previous work at CSE, that we have seen that proper prevention with sustainable management is possible in food systems, even if we take into consideration the intensive animal food production. It is possible, and many countries are doing that. We'll see more examples from Nigeria and even Bangladesh or Kenya. But many countries like biosecurity practices in Indonesia, the banning of antimicrobials by UK and EU to reduce 50% reduction is very much possible. Not just this, in India as well, there are many initiatives, like, for example, by the National Dairy Development Board, to use ethno-veterinary practices as an alternative to antimicrobials that can reduce the use of antibiotics in food systems. Secondly, we've observed and we've seen that preventive solutions, of course, they will make the food system sustainable, that they need to be cost effective and they need to be incentivized to enable upscaling. And lastly, it's very important that food systems need to be transformed holistically and made sustainable. So these are some of the key points that we at CSE have come across, especially in terms of food systems and how prevention is very much possible and how that can reduce antibiotic use altogether. Thank you.
Thank you very much, Gauri. Yeah, wonderful. Thank you. What is clear is, I mean, we can have our screens opened, all the expert panelists, I would request, yeah, so that we can talk. It looks like more interactive. So clearly, Gauri has very succinctly mentioned, wherever she could pick, that prevention is very categorically mentioned and referred to. And we all know that in these declarations, it's the wordings that do matter a lot. The fact that the narrative is now changing towards prevention is something that is very exciting and encouraging. And we can all see we're talking not only about action, we are basically saying financing for prevention. We are basically saying if we improve access, automatically we will reduce the spread of the infection. We're basically saying it's not only about IPC in hospitals. This prevention is now much more in human health, in the animal health sector. It's much more in the waste management. So clearly, as we can see, prevention is cross-cutting. It's all across. Now, let me now just open up with my colleagues here and experts. First, with I would say Dr. Xavier Yewertsky. Dr. Xavier is currently serving as the Deputy Director of Pharmaceutical Services at the Pharmacy Directorate, Ministry of Health, Ghana. Uh, and Dr. Xavier heads the Ghana Antimicrobial Resistance Coordination Secretariat at the Ministry of Health, which oversees the implementation of the National Action Plan for AMR policy in the country. I actually have a very similar question to each one of you panelists, and we can actually see this as your opening remarks. Please let us know, take us through what you think, how the need and importance of let's say, adopting or integrating prevention approach into AMR containment efforts in, let's say, your respective countries would be useful. You can also talk about, let us know about how do you think the recent declaration that we just talked can actually help influence the narratives as well as the national efforts, how it can help shape them up uh, with this narrative of prevention. So over to you, Dr. Xavier, first. Maybe we can have 3 or 4 or 5 minutes for each one of you to respond to, and then we will have subsequent round of questions. So, yes, over to you, Dr. Xavier. Thank you very much.
Thank you very much for organizing this very important session. For us, those of us who were not able to go to New York in September, and giving us the opportunity to discuss this political declaration. Thank you. And I extend my greeting to everyone on the platform. I agree with the statement that our best bet in fighting AMR is prevention. because we don't have the muscle, technological, financial, to fight any outbreak should it happen, especially with the AMR. So first of all, the political declaration is giving us the new direction in the fight against AMR, especially for the lower, middle, and income countries. The prevention aspect of the declaration, first of all, in our view, need to be aligned to the existing policies of the countries. Our fight against AMR is not starting today or this year. It has been in existence, and we have measures in place to prevent not only AMR spread, but other infectious diseases. So that is being implemented. For instance, in Ghana, this year, we launched our review IPC and WASH strategy for the next 5 years. So with this political declaration, what we intend doing is to align the declaration, the issues in the declaration with our existing policies so that we can achieve that common goal as placed by the declaration. So our national action plan and the policy, the aim is to reduce the incidence and the spread of AMR in all sectors. That's the One Health approach. And so I think that our National Action Plan and the AMR policy is already aligned to the political declarations. So I think that we are all moving together. Then what we intend to do with this new declaration and give it moving force is to include it in our National Action Plan. Ghana, we are reviewing our National Action Plan to come up with the NAP2. And so the issues captured or proposed in the declarations will be given a serious thought and then put in practical interventions to achieve them. We, as a country, we are implementing our NAP, taking into consideration the role of regulation. The human beings, the AMR is an issue of largely the behavior of humans. The animal, the environment, we actually throw the antibiotics into the environment. It's the human. So sometimes we need to also have regulations to check our actions and practices. So in Ghana, one of the things that we need to leverage on, existing structure that we need to leverage on, and we are leveraging on, is the implementation, the enforcement of issues on prevention. For instance, we have the Health Facility Regulatory Agency that is responsible for renewing the licenses of health facilities to be able to provide service in the country, health services in the country. So in the assessment tool, they have a very broad area on IPC and a WASH program, to the extent that if you don't have some of these amenities in your facility, you are likely not to have your license renewed. This is actually helping the facility to comply. So the political declaration issues will be digested very well by policymakers if there's a need for us to add some of the issues to the checklist that the agency uses, then we will have to do that so that we can give some force to the declaration. In animal health, we see one of the interventions that we are doing, that is the farmer field school, to be able to reduce, first of all, the antimicrobial use on the farms. And that has been piloted and has given us results, and we are rolling out to other regions. And that is one of the surest way to improve on infection prevention or biosecurity measures on the farms, and then to improve on prudent use of antibiotics. To end for my first section, the environment. The environmental sector is actively involved in the fight against AMR. So they continually check the discharge of liquid waste into the environment from the hospital settings and then the industries. One main challenge with this sector, it is the lack of appropriate technology to be able to treat the liquid waste. And that is one of the issues that we may have to elevate the discussions and see how we can tackle the issues. For now, I will end here and say thank you for the opportunity. Over.
Thank you so very much, Dr. Sevier. I think very clearly what you are saying is a lot of attention your country is already giving on the issue of prevention in terms of policies, enforcement, and you have already seen some of the successes in human health, animal health, and of course there's this challenge of treatment in liquid waste, but you are moving towards it, and perhaps that is something we should take it up. We should talk more about it. Thank you so
Yes.
very much. So let me now move to another country in Africa, Nigeria. We have Dr. Mawapu Nadahi. I'm really sorry if I'm not pronouncing your name correctly. Yeah. So he, Dr. Nadahi is, yeah. So Dr. Nadahi is a veterinarian by training. She works at Nigeria's Ministry of Agriculture as the country focal point for veterinary medicinal products and antimicrobial resistance for the World Organization for Animal Health. She is a member of the One Health AMRCC, which is Antimicrobial Resistance Coordination Committee, and also National Technical Working Group for AMR, and supports the implementation of AMR interventions in the animal health sector. So over to you, Dr. Mawapu.
Thank you very much, and hello, everyone. Looking at the political declaration from UNGA this year, in my country, Nigeria, what we do to prevent AMR is, first of all, looking at governance and coordinated multi-sectoral response. So in the country, we have a multi-sectoral One Health governance structure that is guided by a One Health governance manual. Now, the manual highlights the terms of reference and the governance structure in the country, because whatever intervention you're going to take in a country, it has to be coordinated. Because if everybody is doing or implementing AMR mitigation strategies in different sectors, you know, it will be disjointed. And so we saw the need to set up a multi-sectoral coordination unit called under the AMRCC, that's the Antimicrobial Resistance Coordinating Committee. The importance of governance is such that, you know, because in the structure we have the steering committee, we have also the AMRCC and the National Technical Working Group. Whatever activity we do at the end of the day is reported to this steering committee. And I'm happy to say that Nigeria has just developed her new National Action Plan, NAP 2.0. And in that new NAP, we have added one strategic objective to what we had earlier in NAP 1.0. And that has to do with governance and coordinating mechanism. Now, while launching this new National Action Plan, we also presented to government a policy brief highlighting all the challenges of AMR and what we expect the government to do. And that takes us to another part of the declaration that talks about financing. Now, there is need for government to commit to AMR mitigation strategies for sustainability, because as it is in most LMICs, AMR activities or interventions are usually donor-driven. And so there's need for country investments to make sure that these activities are sustainable, so that when the partners or the donors or the projects end, the countries can take over and it becomes part and parcel of day-to-day activities. That way we'll be able to prevent AMR. Another aspect is, because I come from the animal health sector, I will talk about the preventive measures from the animal health sector. And that has a lot to do with, I would say, awareness, because the stakeholders involved need to even know, first of all, what the problem is. From the professionals down to the farmers, they need to know in clear terms what AMR is and what the dangers of AMR. And not only the dangers, but then the way out, and that is the preventive measures. And so in the country, what we have done in the animal health sector is, first of all, to develop a policy document. We have developed an AMR policy for the animal health sector on AMR, highlighting activities that we intend to carry out to mitigate AMR in the sector. Secondly, we also have developed biosecurity guideline documents and standard operating procedures for poultry and aquaculture, because these are the two sectors where antimicrobial agents are used the most. And so having these documents would help those that are training the farmers to give appropriate messages to these farmers. I would say that when you tell a farmer to give an animal the same water that you want to drink, the farmer might think that, why should I do that? But in essence, if we truly want to prevent AMR, they need to drink the same water that we drink, and so many other preventive measures that need to be put in place. In terms of preventive measures as well, we have developed treatment guidelines to guide professionals on how to go about prescription and prescribing these products, knowing the first line of action, the second line, and then the last line. Taking note of critically important antimicrobial agents in human health, WAAW has outlined that antimicrobial agents such as colistin, the fluoroquinolones, the third and fourth generation cephalosporins should not be, if not absolutely necessary, be used in animal health, because these are important products for use in human health. And so the treatment guidelines was produced in such a, or developed in such a way that these important issues are taken care of. In terms of access also, we have, or stewardship, I would say. Recently, I think 2 weeks ago or 3 weeks ago, we just developed a stewardship, antimicrobial resistance stewardship strategy for the animal health sector. We know that the human health sector has stewardship programs, but there's none in the animal health sector. So we decided to develop this document to customize it in the animal health sector, because this is aimed at establishing stewardship committees in veterinary teaching hospitals, clinics, and state hospitals as well, to ensure that, prudent use of these products in the hospitals, and at the same time understand the resistance profile of resistant organisms vis-a-vis the antimicrobial use data collection in those sites. This would help a lot in accurate diagnosis as well as treatment in these sectors. So these are areas that we see are important for us to prevent antimicrobial resistance. At the same time, we are working towards developing essential medicines list and prescription policy that will guide professionals as well. And as Xavier mentioned, we are working hard with the regulatory authorities to ensure that, to ensure prudent use of antimicrobials and in the sector. So with that, I think I will just pause for now. Thank you.
Thank you very much, Dr. Mawapu, for your very clear, practical approach that I think what you shared is something that the world needs to know about. What do you need to really do on the animal health sector? I mean, clearly you're talking about awareness first, you're talking about biosecurity guidelines, very critical. SOPs you're talking about in poultry and aquaculture. You're also talking about importance of water, something that is not only very, very useful in the human health, but also in the animal health, often missed by many, many players, stakeholders. And water in the farms, if you get it right, you actually prevent a lot of diseases at its first place, and therefore the need for antimicrobials. Then you're talking about stewardship policies targeted at the animal health and treatment guidelines, and also CIAs. So very, very encouraging, Dr. Mawapu. I think there's a lot that all of us can actually learn and get to know from you. Wonderful. So we move to the next colleague of ours. We come to Asia, uh, the continent where we also come from. Uh, Dr. Mohammed Abu Sufia. Dr. Sufia is currently working as Director, Department of Livestock Services, Bangladesh. And he's been there for about many years, and in various capacities. and he has vast experience as a as a focal point for WAAW, World Organization for Animal Health, for veterinary medicinal products. And we are happy to have him. I mean, this is the first time we are getting to listen to him and getting to know about what our neighboring nation, Bangladesh, is doing. So, thank you so very much, Dr. Sophia. I'll just repeat the question once again so that we know. What we are trying to understand in this round of question is from you the need and importance of adopting or let's say integrating prevention in the AMR containment efforts. And if you can also throw upon your thinking, throw upon your some light, your perspective on how you think this political declaration will influence the narratives and shape the action in Bangladesh. So over to you, Dr. Sophia.
Yeah, thank you, Amit, for your discussion. So, distinguished participants and my dear panelists. So, good afternoon. Thank you for the organizer for giving me the chance. Very important session as we are now holding the AMR week in our country also. So, as maybe you all know that the Bangladesh is small countries, but too many population, 170 million people here, and around 50 million of small and large ruminant, cattle, sheep, goat, and more than 300 million of poultry, chickens. So in Bangladesh, we have too many people, too many livestock. So we are now working with very close collaboration with One Health approach, because we have a very strong structure, because we have a government One Health Secretariat and funding by the government. So now the government of Department of Human Health is the funding for this secretariat. So in the secretariat, animal health, human health, and forest peoples are working. So through the One Health approach, we are tackling the important issue of the antimicrobial resistance. And we have a very, in secretariat, we have a dashboard. So we are regularly share the AMR data in this dashboard. So this is very unique in Bangladesh to share the information. Not only the other zoonotic disease also shared through these three departments. So now I'm focusing today topics. Prevention is our best bet for controlling AMR. As you previously mentioned that prevention in human health, we always know that prevention is better than cure, because in animal sector, as an animal people, it is most important, because diverse species of animal and lots of animal population. So we need prevention. So we have a very biosecurity practices through the FAO actor. We developed a biosecurity guidelines with 16 principles, like the access control in farm, movement control of vehicles, personal management, washing, equipment management. So in this approach, medicinal cost is reduced significantly. So we conducted a very small pilot program through these biosecurity principles, and we found that, so if a farmer owners strictly maintain these biosecurity principles, and we found that he or she reduced the significant medicinal cost. We found that the 6 taka per kg of broiler production reduces medicinal cost. So this is very important for in case of poultry farm in our country, and we are more focused biosecurity practices. Besides that, government produces around 320 million doses of vaccine, poultry and large animal vaccine. This is also distributed to the farmers, very minimal cost, just subsidized cost. And another important action government already taken through the eradication of some important diseases like the PPR for goat. So we already conducted second dose of vaccine, around 30 million doses of vaccine just completed last September. And we hope this is the second time. So total 60 million doses of PPR vaccination coverage all over the country. through which we are now treating as a PPR control. So through this control program, there's much less use of antimicrobials. So there is another mass awareness program and something like in all over the countries. If I say that the documentation, we have a very good documentation. We have a very national antimicrobial resistance containment plan in one health approach. This is the third edition, third time we revised it. We have a very good treatment guidelines for poultry as well as the large animals. Very good treatment guidelines. We are now drafting the antimicrobial stewardship program. And we have a very good legal documents also, because Bangladesh is strictly prohibited of antimicrobials in animal feed. We have a very good law, Animal Feed and Fish Feed Act 2010. In this rules, in this act, they are strictly prohibited. So regarding the regulatory affairs, we have a very good document and we have a very regulatory, but as you mentioned, that implementation in the field level is challenging. Maybe later we discuss. So as you mentioned that the political declaration, I think it tremendously helped to policy level people in our country. Because just yesterday, 19 November, officially start our AMR week with inaugurated by our advisor, Minister of Fisheries and Livestock. So top level political commitment we have in our country. And this political statement in September in General Assembly, it may be held to our policy level. As for example, in section 72, the mention of the vaccination program, especially the priority diseases. This is very important. And maybe we can convince our policy level people through this. And in section, as for example, in section 73, that mentioned the equitable access to essential veterinary services. This is very important. As you mentioned, we have a very lots of people, lots of animal population. So as this is my last comments, previously environment is not emphasized in our national action plan. So this year we as quadripartite partner is now working. So this year environmental sector is included in our national action plan, and we try to more focused on environmental sector, because environment is an important factor for control of antimicrobial resistance. So through this, I think through the political commitment, this document may help to convince our policy level people to contain the antimicrobial resistance in our country. So this is just all over my side. Over to you, Amit.
Thank you very much, Dr. Sufia. I mean, basically, what I can gather is that Bangladesh is doing some very, very important, they're already taking some important initiatives, particularly with reference to biosecurity guidelines. There's a lot of emphasis on vaccination that I could see. There's a lot of emphasis on documentation that I could hear from you, so which is interesting. And of course, there are challenges, and you also mentioned about implementation challenges. I hope to be able to discuss it in the next part of the session. So let me now move back to Africa. So let's hear from our colleague from Kenya, Dr. Emmanuel Tanoi. Warm welcome, Dr. Tanoi. Dr. Tanoi is a specialist working in the Kenyan Ministry of Health, Division of Quality Assurance. And he's the National Antimicrobial Resistance Focal Point and Secretary to the National Antimicrobial Stewardship Technical Working Group. He's also a member of the Joint National AMR Secretariat. So basically, we are having the most important people for us to be able to know about AMR in the respective geographies. So yes, over to you, Tanoi. If you want me to repeat the question, I can do so. Or you think it's okay? You got the gist of it, yeah?
Yeah, I think that's okay. Thank you very much, Amit and Aurora, for setting the stage and this invitation to share our perspectives from our countries. Appreciation also to the speakers who have spoken before me. So we have a very good opportunity for us as low and middle income countries to be able to raise the visibility on the fight against AMR in alignment with what our political leadership raised the profile in the declaration following the high-level meeting, to address the drivers on AMR. We are all aware about the biggest cause or the biggest drivers of AMR are the misuse and the overuse of the antimicrobials in the different sectors, and more importantly, the human and the animal sector. We are aware about the issues of poor infection control practices, the challenge of accessing clean water and sanitation, which is a big issue, especially in our low and middle income countries, and the lack of access to good quality health products and technologies. So these things, quite rightly, will be well addressed when we refocus our attention on the preventive aspects, as what Sevi has mentioned. Our LMICs may struggle to be able to contain a global level outbreak if that were to occur, or even to manage access to the reserve medication that under normal circumstances would be a challenge to access. So as a country, we have prioritized addressing these drivers through our national action plan, which is similar to most of the other countries, prioritizing the 6 objectives where we have included governance. So governance and coordination is very important for us to come together and consolidate our efforts, ensure that we have the maximum efficiency of the use of resources, directing implementation of work to all different levels of the country, because for us, agriculture and health is devolved. So it means that we need to work, the national government as well as the sub-national government needs to work in tandem with the sub-national unit, so that we can have efficient implementation of work. One challenge that a lot of the LMICs have is usually accessing a national budgets for dedicated funding of AMR work. And we are glad that there has been refocus in trying to provide some form of catalytic funding, one from the global level, and also to get commitment from leadership that they are going to provide dedicated funding for a national action plan implementation. 3 areas that we have been focusing, and we are still focusing on, is creating awareness and understanding, because we believe that
Dr. Danoy, yeah. Please go ahead. Now we can see you well.
Yes. When people are aware about the impact of their practices, then they are able to change behaviors around the inappropriate use. They are able to change the practices around the poor infection control in our facilities, for example, promoting hand hygiene and the proper waste management. The declaration really talks about provision of water, sanitation, and hygiene, as well as the proper waste management, which are those areas that we are trying to focus on. In terms of training professionals, health workers, veterinarians, and as well as members of the public and farmers, so that we can reduce the need for antimicrobials when animals are raised in hygienic conditions. So we have developed the biosecurity guidelines for the major value chains of dairy, poultry, and pig. And we have sensitized farmers about these guidelines, so that they can be able to ensure that their farm production areas are not breeding infections. The other challenge that we've had in terms of creating awareness has been getting the resources to do physical training of professionals. So we have tried to develop training modules for infection control, antimicrobial stewardship, and AMR, which we have hosted in our virtual academy, so that any professional can be able to log in, can be able to read, can be able to do the assessments, they can be able to assess themselves, and thereafter get a certificate. And in the process, we are disseminating this information to reach those geographically difficult to reach areas in our country. We also have bi-weekly mentorship sessions where professionals are able to log in. We have a mixture of didactic cases as well as didactic presentation as well as cases, real cases from facilities that they have managed the patients, and so they highlight the IPC strong points, the AMS strong points, so that other facilities can learn from some of these practices. Talking about promoting the prudent use of antimicrobials, which is one area that is very important in terms of reducing the selective pressure for development of resistance. We are now disseminating our Kenya Essential Medicines List 2023, which has highlighted those essential medicines that need to be available in all in different levels of facilities. So there are those that required at the tertiary level, there are those that are required in the secondary level, and then there are those that are required in the primary level. So these essential lists guide the procurement, the distribution, and even the access of different medicines in the different levels of care. So in terms of agriculture as well, which is very important, is encouraging the responsible use of antimicrobials through partnership with our Kenya Veterinary Board as well as the Veterinary Medicines Directorate to first sensitize the professionals, strengthen the enforcement, because we already have the regulations. Our challenge across the different countries has been enforcement of existing regulations. So we are working together in collaboration in sensitizing them about the importance of abiding by professional ethics, sensitizing the members of the public about the risks of self-medication and even sharing medications and so forth. Last but not least is the issue of environmental contamination. I think this is one area that is one of the drivers of resistance, we have had some joint collaboration between the National Environmental Management Agency together with the human health regulators on ways in which they can ensure that they enforce what you call the aid memoir, which was developed courtesy of the different quadripartite organizations on how they can enforce pharmaceutical discharge, identifying what are the safe levels of antimicrobials, what the pharmaceutical manufacturers can do to ensure that they do not discharge antimicrobials to water systems. Thank you very much.
Thank you very much, Dr. Thanoi. I think you clearly outlined some very important aspect, and the one that I really liked was awareness. I think that is a very important prerequisite, and some of the comments I see from in the Q&A and chat also is like even before implementation as a challenge to address as a challenge. I think one of the most important thing is vis-a-vis prevention is awareness. And you also then touched upon training, which is actually very similar to awareness. It's like awareness of the stakeholders. So I think that's a very, very important message that I draw from your end. I know you also talked about a couple of challenges. So thank you so very much. Let me now just move to what is very clear from all the what we have heard is, to be very honest, there's a lot of, I would say one, the understanding, cross-cutting, the understanding on prevention, let's say the initiatives is what needs to be done is there. A lot of action is also happening with reference to guidelines, SOPs. But of course, we still know, and I also come from LMIC, implementation, we all know, is a big challenge. Now, some of you have touched about it as a challenge. I think what we can do is perhaps just do one more round of questions focusing on key challenges What I would you see in implementing, or let's say any other challenge you see in, but I would request you to focus on challenges or implementation with reference to preventive approaches. Let's stick to the discussion, to the focus of the discussion, which is prevention. So let me rephrase it. What kind of challenges or possibilities you say you feel in your respective geographies with reference to a preventive approach to containing AMR? So you can cite some examples if you have. And it is not just about implementation challenges, it could be about other challenges. But let us dissect it a bit more to be able to understand what are the challenges and then where lies the possibilities. Let's just not talk negative, also talk about the where is the light at the end of the tunnel. I mean, let's focus also on the solution side of it. So we'll, if everybody is fine, we go the same order, right? Dr. Xavier, can I just come back to you? Yeah, couple of minutes, just focusing on challenges and possibilities with respect to prevention approaches to contain AMR in Ghana.
Thank you very much for the opportunity once again. Yes, so for the preventive aspect, the challenges that we face, we can segregate them into several bits. For instance, we know the causes of AMR, so we can talk about poor quality antimicrobials. So we tend to be treating, but the medicines are not of quality. So one of the challenges is the ensuring that we have quality antimicrobials in the supply chain, especially the vaccines too, for the animal health, the vaccines they use, and the human health. We have to work on the quality of that side. And so this is it falls in the purview of the regulator and also the society, because in Ghana, we have the app that if you are taking the medicine and you are not getting results, you have the opportunity to use that app, and the regulator picks the issues and they go about doing their investigation. So these are the possibility things that we can improve on to do that particular one. And then we also talk about the practices in the hospitals or the healthcare facilities, especially when it comes to the issue of IPC. As I earlier said, it's a human factor. There are things we should do, but we are not doing them. And that is why we are creating the resistance to take place in the first place, even helping it to spread from the hospital setting into the community. So this is a main challenge about the human behavior, how we can work on the human behavior to understand that we are the one contributing. And so to do this, we want to, the quality improvement strategy, that's you together identify the problem in the facility or your environment. Together, you find out the solution to it yourself, and then you implement and monitor. By so doing, this will help us improve on the preventive aspect, especially when it comes to misuse of antibiotics. I can give one example. There's facilities that are working on the misuse of antibiotics in safe delivery. A woman delivering a baby without any cut, but they are found to be taking antibiotics for 5 to 7 days. So you ask yourself, what are they actually doing? And so we see that as inappropriate use of antibiotic, trying to throw antibiotics into the system. Remember, these antibiotics found themselves in the breast milk, and the innocent baby will be taking antibiotic for no cost. And that's an abuse. So they identify the challenges, and then they put intervention. And that has also improved on antimicrobial use when it comes to mothers who have delivered babies. So it's about identifying the challenges in our facilities ourselves. And then we ourselves should find a solution to it, because there's a lot of literature saying if you do this intervention, these are the results you will get. Well, when you come to the animal health sector, one of the preventive issues is about what is the incentive for the farmer. If you ask the farmer not to use antibiotics, because he's thinking about the investment. If I don't use antibiotics or antimicrobials on my farm, on the animals, I may lose them at the end of it. Because they also use their antibiotics thinking that they are preventing disease in their animals. So there must be a concerted effort to churn out incentive that will give assurance to the farmers that they need to, for them to move away from the use of antibiotics. And then also there must be interventions to prove to the farmer that it is not the growth promoters normally do not have a place, but you're actually causing a problem for the society. So these are some of the challenges. For the environment, what do we do with the environment? We know from studies that we have done in our country, Ghana, through the Tricycle project, shows that even the environment, the water we use to water the lettuce and the vegetables are contaminated with bacteria that are resistant to the commonly used antibiotics. So the challenge is, how can we break the chain from moving the resistant pathogens from the environment into the human or into the food chain? So this is an area that we have to work on through education of the farmers and then the consumers. And they should form using those research findings to develop appropriate messages for the community so that they will improve. They will know that when they wash their hands, for instance, wash the vegetables before eating, washing the meat products and cooking the meat properly, then they will prevent the movement of the resistant pathogens from the environment into the food chain and then into the human health or into the human body. So these are the areas that we have to look at. We know the challenges, and then so we need to put in that intervention. The other one is about financing. It's becoming very challenging to be able to do some of the issues. And so Ghana, what we doing is that every facility, hospitals or institutions must mainstream their antimicrobial intervention, the preventive interventions into the budget of the ministry or the sector, so that if there is an approval, you'll be able to have some money to be able to do some of the basic interventions. And so, and especially the preventive aspect of it. Thank you.
Dr. Xavier, thank you very much. Perhaps many of you would have noticed that the colleagues from CSE and myself, they were completely off. There was some internet shutdown, but thankfully we are back now. We missed perhaps 2-3 minutes of your conversation, of your points, Dr. Xavier. But what we'll do is that in the interest of time, we'll move ahead, we'll move forward. As you can now see, my colleagues are coming back again. We are using our mobile phone hotspots. So yeah. So thank you so very much. And whatever inconvenience it has caused to our participants or the viewers, we apologize. So Dr. Xavier, if you think, the last I heard you was when you just started the animal health. If very quickly, let me just say, for 2 minutes, you want to go back and let all of us know, I'll be very grateful. What did you say about the animal health? And then you were talking something towards the end. Can you do that? Xavier? Dr. Xavier, can you hear me? Oh, now we lost. Oh, we see it.
I'm back. I also have a problem with the
Yeah,
internet. So I was talking about the animal health sector, we need to put in intervention, especially for incentives for the farmers. The farmers have made investment, and the pushers of these medicines on the farm convince them that if you don't give the medicines to your animals, you may lose them. So, but we are also saying that with literature, with research findings, there's probably no need for this antibiotic that they use. So what is the alternative for them? That's why we need to promote the incentives for the farmers, especially things like, can we put in place registered farms that in the event that there's a natural disaster, things that are beyond them, while they adhere to the biosecurity measures, government can come in and share the cost with them so that they don't lose totally. These are some of the interventions we can put in place to be able to encourage the farmers to adhere to the biosecurity measures to improve on antimicrobial use. And I was also talking about environment, that the environmental sector, the findings that we are getting from Ghana, the evidence from our soil shows that we need to use the findings to formulate educational materials, messages, to tell the patient or the society why there's the need to wash their vegetables before use. And then also we must come out with things that can be used to wash these vegetables. Because if you ask me to wash my vegetable, I can use water. Would the water be able to take away the resistant pathogens from the leaves of the lettuce that I'm going to consume? Then there must be some recommendations of the type of chemicals or what to use, safe chemical to use to clean this vegetable before we use. And then also why they have to do this to break the chain from transmitting resistant pathogens from the environment into the food chain and then into the human life. So these are the areas that we have to look at. They are big challenges. And then the financing part of it that I was talking about, that preventive measures are big. For instance, a study shows that water from certain part of the country contains bacteria that are resistant. So it means that there will be a need of government effort to provide clean and potable water. The treated water must be of high quality, devoid of too much bacteria, pathogens that are resistant genes in the water bodies, because other than that will continue to be transmitted bacteria into the human life. Over.
Thank you. Thank you so very much. I think you have touched upon two very important points. Water, which again comes back to the story, prevention story, the importance of clean water. But I just want to quickly draw from your point on the incentive for farmers. Just to let you know, there's this National Dairy Development Board in India, which works with various states through cooperatives. And they have been doing a lot of good work, and they have been able to reduce the antibiotic use through traditional preparations. uh, and they have tested, they have documented, there's a good evidence how to control mastitis in particular, they have been able to reduce the antibiotic use. But most important thing here was the upscale happened because it was cost effective. And that in a way was what you were saying, incentives for farmers. So uh, there has to be incentives, and it has to ultimately, in case of the farmers, it has to come across as a very strong economic case for it to be upscaled. If that is not happening, then it will be very difficult to actually implement a lot of the guidelines that we have, either SOPs, biosecurity, whatsoever, and take them forward, take them to deep into our production farmers community, and encourage them and entice them to take this forward. So very important point. So we have run out of time. We have lost some time because of the connection problems at our end. I'll quickly move to Dr. Mavapu. Challenges and possibilities with reference to prevention, taking them forward in your country. Thank you. Please go ahead.
Yes, thank you once again. So in terms of the challenges for the implementation of AMR interventions in the country, one of the major challenge is financing and, allocation of, budgetary allocation for the implementation of AMR interventions. So one of the strategies we have planned is to continue to advocate, meet the political leaders and conduct advocacy visits using policy briefs, evidence-based data showing them the magnitude of AMR in all the sectors. Because when they see the data generated and the magnitude of AMR in terms of GDP, then the political leaders would listen. And that is the strategy we intend to employ. Another challenge is in terms of enforcement of regulations. It's not easy for people to change their practices. So that is one of the major challenge. And as I mentioned earlier, we have developed an AMR policy document. And in that document, we've highlighted steps to achieving, the success of enforcement of regulation, one of which is the establishment of a joint task force comprising of the different regulatory agencies, the ministries, departments, and agencies, as well as the farmers themselves. All stakeholders will be involved. And we intend to do that at all levels. Excuse me, please.
Okay, seems some problem at, okay.
Sorry about that. So we intend to do that at all levels. And the joint task force would ensure that, only registered personnel are allowed to handle antimicrobial agents. And that way we would get rid of what is being sold in the open market. It's going to be a long journey, but we intend to begin that journey one step at a time. Another challenge is the porous borders, where the infiltration of maybe substandard products. And so we are working closely with the National Agency for Food and Drug Administration. They have staff at the borders to ensure that, there's restriction of movement of such products across the borders. Then when it comes to educating farmers on biosecurity measures, they would think that we are giving it's going to be an additional cost. But the idea is to train them and educate them, educate them on the cost-benefit analysis of biosecurity measures. Because in the long run, when they implement effective biosecurity measures, it's going to reduce the cost of production. Then vaccination is another challenge. It's not as if we are not conducting nationwide vaccination, but ensuring that the vaccination is effective, putting into consideration cold chain mechanisms and the right dose, and administering the appropriate vaccines for the appropriate diseases. So to achieve that, the government has established in the ministry a sanitary mandate division. That way, we intend to engage private veterinarians that would make quality veterinary services available to the rural populace. That way, when we do animal health interventions at the local levels, farmers will have access to quality veterinary services, and as well as training community animal health workers, So these are the steps that we intend to take to mitigate some of the challenges I mentioned. Thank you.
Thank you so much. Thank you so very much. I mean, I like your point on vaccination actually, because we have been hearing a lot about vaccination, but you have highlighted some of the challenges which I think are very realistic challenges, and they come across that they basically make it if you address them, then only vaccination would be like extremely useful. Now, but they have to address it well, and at the same time, they have vaccination as a strategy has to be cost effective. That is very, very critical. So thank you so very much, Dr. Mabapu. Let me just move on to Dr. Sufia. Same question with challenges and possibilities with reference to taking forward the prevention approaches. One addition, Dr. Sufia, you talked about biosecurity and you talked about vaccination quite a lot. And we just heard from Dr. Mabapu about the challenges on vaccination. How do you see vaccination as a strategy? Do you also see some similar challenges? And if yes, then what are those and how do you see those can be mitigated? Over to you.
So thank you very much. So yeah, as I mentioned, there's too many people, small country, too many livestock population. So we are facing challenges, especially for small scale farming system, especially poultry industry, poultry farming system. We are facing challenges in the very rural poultry population. So they are facing challenges for improvement of biosecurity practices. So of course, awareness is the important factor, as you mentioned, that before the implementation, awareness is important. So this is also challenging to state aware the people in the root level. We are now trying to motivate these people, but still this is one challenge. Number two, as you mentioned, the vaccine issue. So government now trying to subsidize vaccination program in root level, but it is very difficult to cover all the area. So government is very small scale farming system. They are done subsidized vaccine we are giving them, but to cover the and specific disease related vaccination program, this is also challenging. As you mentioned, the cost effective vaccination, because majority of the vaccine are imported outside the country, and this is very expensive, and this is usually used for the commercial industry people. And this is also one challenge for small scale farming system. And another challenge is that as Xavier mentioned, that the incentives. So all as farmers wants to evidence-based information. Why I use this? Why I practice this biosecurity? So this is one of the challenges. We are not trying to make some evidence, but this is also challenging in our country. If we make more evidence, maybe we can easily avoid the farmer. And another important thing is the alternative to antibiotics. We are not now promoting to, as you mentioned, for mastitis in India, some special treatment guidelines and some therapeutic medicinal already started. We know. We are not trying to motivate these people, but this is also challenging. Sometimes they only depend on the antibiotics, not the other alternative to antibiotics. So this is all the, and finally, as I saw the political declaration, I'm a little bit hurt because overall more than 70% antibiotic use in animal health sector in worldwide. But a little bit less importance in the political declaration, because with the animal health sector, it includes the agriculture. Why? I don't know. It must be alone. We have to more attention to animal health sector in compared to human health. Otherwise, animal health sector is always behind, lagging behind. If animal health sector is lagging behind, finally our output is to serve the people, human health. Otherwise, there is no much importance, much antimicrobial resistance containment in human health sector. So always in our country also have some financial budgeting, more focused. Of course, human health sector is more focused, but it should be more focused in animal health sector, because otherwise we will not proceed move forward. So this is just my side. Over to you.
Okay, thank you so very much, Dr. Sophia. I mean, you have actually answered quite a lot, focusing on the from the animal health side. Just to respond to you about your last point, as much as I know, I've been following this space for about a decade and a half. I can tell you the focus was, yes, rightly on the human health side. Animal health sector did not really get much focus. Environmental dimensions, not at all. Very, very limited. Over the years, there is a change, a positive change. Now we see much more attention also given to the animal health sector. And this political declaration is an example of that. I can say that with quite a lot of surety. We didn't really see this much attention earlier. So that is why this declaration, and in fact, the developments over the last few, let's say, years, one clearly sees the change in the overall narrative. Now we are actually not really saying this is your problem, this is my problem. We are basically saying this is our problem. And we have to address it collectively. We are also now saying that each one of us has to get our house cleaned up before we point fingers at the others. We're also now saying that it's not just about surveillance, surveillance, surveillance. It's now also about stewardship. It's now also about prevention. I think that is where the journey of this global commitments, if I may say, or global narrative or global recognition of the problem has changed, and it has changed for the good. The only thing is whether it is there, it is up to mark. All of us can vary in our opinion, but nevertheless, I can assure you that things are better than before, vis-a-vis where we stand today. Uh, we have less time, Dr. Tanoi. I give it over to you now. You have already talked about challenges, but whatever you wish to add to the discussion, please feel free.
All right. Thank you very much. I will try as much as possible not to repeat what my colleagues have mentioned, especially in terms of the challenge around enforcement and compliance to regulations, which is, I think, is one of the biggest challenges for us around discouraging the misuse or overuse of antimicrobials. I think there is really needs to be a very deliberate capacity building and empowerment of regulators, our regulatory agencies, and also increasing the sensitization of the members of the public on some of these issues that they undertake. One area that I think maybe has not been mentioned adequately is the challenge of the health system inadequacies, which is, I think, is a common problem in our low and middle income countries. The provision of clean water, sanitation, and hygiene. We are all aware about how the lack of clean water and sanitation is a promoter of proliferation of multi-drug resistant organisms. So we need to prioritize investments in providing funding for the basic health infrastructure. We know that quite often when you go to a facility and you go through the entire process, you find that quite often the microbiology lab is running out of consumables, reagents, or even standards for carrying out identification or susceptibility testing of a priority pathogen. So there needs to be a sustained support. And also for the issue of the lack of adequate access to continuous health products, I think that can easily be addressed through the capacity building. I liked what
It seems like everybody
the
is having,
challenge
yeah,
the farmers you
now you're back,
yes.
please.
Yes, sorry. I liked what Xavier mentioned about the issue of farmers, providing them with an alternative. When you tell a farmer, stop using an antibiotic because you're promoting resistance, they will think about their profitability. What else can I use to ensure that I get the same profit that I've always been getting? So we need to really strengthen the issue of biosecurity, telling them that as long as you practice hygiene production, you will not need to use an antibiotic. If there are other alternative preventive measures that have already been explored, I think those are the ones that we need to encourage. We heard about examples from India about how farmers are joining big cooperatives that can be able to pull together the resources, train farmers, provide support to farmers in case they have challenges. I think that is the way that we should really try to encourage. The last but not least is the involvement of the environment sector. Over the many years, we have not strongly involved the environment sector, and we know that a lot of the activities we carry out in the human health and the animal health eventually end up in the environment, the discharge. So the environment is the recipient of all our inappropriate behavior. The environment is it grows. The ecosystem is the one that cultures this back. So we need to involve the environment very strongly if we are hoping to have a success in our preventive measures. Thank you.
Thank you very much, Dr. Tanoy. Very, very interesting, very useful. We don't have much time for questions, and it just from the audience, and it just so happened that I have lost questions on my dashboard because I disconnected. So I just can recall few, but very quickly, Dr. Tanoy, I can see one specifically for you. What's the name of the online course that you were mentioning? There's a question from Pradeep Yara. If you could tell about that. You mentioned about an online course, training course.
Yes, you can be able to access that online course from our MOH website. It's called elearning.health.go.ke. I'll paste the answer there on where the question is so that they can be able to access it. I don't know whether you can be able to see it now. elearning.health.go.ke.
Okay, all right. I think our colleagues will share this anyways with everyone. Uh, and then there's a question, there's a data given on the antimicrobial consumption by someone. So that's not really a question. So yes, we see your this thing, the link that you were saying. So let me just very quickly now wrap this up. We are just 1 minute away. Thank you, Corey, for switching on your videos. So very quickly, let me just wrap this up. I would not even attempt actually, because this has been a very, very rich discussion. Clearly, I think all of us realize, yes, prevention is important. All of us realize, yes, ANGA declaration is very critical and it captures quite a lot of it, particularly with reference to prevention. Some important points which really struck me very, very simple, was very, very easily, were awareness, water, quality of medicines, incentives. And then, of course, there were specific points on vaccines, biosecurity, alternatives, oral orders. So clearly, we have clearly outlined a lot of these areas which basically give us a clear direction in terms of, if we work right, we get these right, we'll get a lot of work done. But I just want to mention here that uh, at CSC, we have been trying to understand and create a framing out of it. And that framing for us, or let's say for any developing countries, as follows. What we see is that if it's about prevention in the animal health sector, it's clearly about patient management. How do you manage the patient? If it's about prevention or let's say containing AMR in the humans, it's essentially about how do you grow your food. That's, if you get that right, you sort it out. And if it's about in the environment, it's actually about how do you manage your waste. Keeping these things in mind, what we have figured out is that one, of course, is we need to have a, if I may say, a conservation agenda. And we have been talking about that, which basically means we have to conserve what we have. What antimicrobials we have today, it is very clear that they are losing efficacy. If the new antibiotics are not being developed, you got to conserve what you have. And that in itself is a very important preventive approach. With that, we mean you got to work towards phasing out antibiotic use for growth promoters. You got to work towards phasing out antibiotic use for prophylactic use going forward. And of course, conserve the critically important ones. Antibiotics which save lives in hospitals and ICUs should not be used to fatten up the chicken. It's a very broad narrative, very broad point that we got to conserve. The second is uh, we got to have a development agenda, because LMICs will have to grow. Food is about trade, and we know many of our countries have a lot of food productions, big food production systems now growing intensive. But our development agenda cannot be, let's put a lot of chemicals first and then clean it up, then spend a lot of money. It has to therefore be about growing, to be able to grow without chemicals. And that can only happen if we not only reduce, prevent, but also we have a long-term strategy. And the long-term strategy, in our view, would be developing a roadmap to reduce the dependence of industrial intensive food systems, perhaps focusing more on decentralized cooperative model of food systems or backyard farming, which in our country or our parts of the world is already very prominent. How do we scale that up? Because somehow that is more sustainable, not just because of antibiotics, but also because of climate, energy, livelihood, nutrition. There's a co-benefit, a lot of co-benefits that work towards that. So if we want to get our food right, we got to have a short-term approach and we got to have a long-term approach. The third is environmental agenda. We got to manage our waste. Prevention in waste is managing waste from farms, factories, hospitals, household settings, sewage treatment systems. And one important part here is segregation of the waste, end of pipe treatments. But what is most important here is first to not really put too much into the system, so that it goes into the waste. That again is linked with reducing the occurrence of the disease at the farms. That is, so that you do not need that many antibiotics, you do not put that many, so that ultimately you don't have to manage your waste too much and spend too much to clean it up. So that's a waste agenda or the environment agenda. And the last is prevention agenda, which actually is cross-cutting, which in India starts from folding your hands instead of shaking hands, because we all saw that how it impacted COVID. We all saw the importance of social distancing, and then we have a stocking density, very high stocking density farm. How do you really expect that disease would not really occur at its first place? So we got to think through that, really think from the point of view of prevention, which is cross-cutting. And prevention in environment could just be segregation. Prevention in human health could just be simple infection, breaking the chain of the infection. Prevention in animal health could just be doing the biosecurity right. So there's a lot of individual specific steps that in each sector one must do. But by and large, this is what we have understood, that if we want to develop and if we want to grow, contain AMR, we will have to focus on our waste. We'll have to get our food right. We'll have to conserve what we have, and we'll have to prevent, and prevent. So with that, I would like to say a big thank you to all our panelists. I would also like to say a big thank you to all the colleagues and all the participants in the audience who have been here. I mean, we are like stretched by 5 minutes already. And of course, a big thank you to my colleague Gauri and Rajeshwari and my colleagues in the media team, Sukanya, and the entire AMR team at CSE. So we hope to stay in touch. We hope to be at it. We hope to keep working at it. So we hope you all found it useful. So with that, a big thank you. Yeah.
Thank you. Bye.
Yeah.